Hi guys, and welcome back to my channel. Let's practice your listening skills today. And I'm gonna read an article to you guys like I did last time with the first listening video. And today's topic is, it's a very hot topic that everyone's talking about at the moment. You guessed it, it's the coronavirus. So, you ready? Let's go.
Novel Coronavirus 2019 NCOV. What is novel coronavirus? The novel coronavirus identified in this outbreak has never before been identified in people. However, coronaviruses are not new and cause infections like the common cold and rarer infections like the Middle East Respiratory Syndrome, MERS. The term coronavirus refers to a big group of viruses that cause a wide range of illnesses. This new coronavirus has been called 2019 NCOV. Who is most at risk of infection with 2019 NCOV? Some people will not get sick at all. Some will get mild symptoms from which they will recover easily, and others will become very ill quite quickly. Because this is such a new infection, very little is known about why some get sick while others do not, and in whom there is a greater or lesser risk of serious infection. Experience tells us that people with compromised immune systems, the very old and young, and those with diagnosed heart and lung conditions are most at risk of developing complications if they contract an infection like this. Early information about this virus is indicating that children may be less likely to get sick with this virus than adults. Health workers are potentially at risk of infection if they are in close contact with a case of novel coronavirus infection. As a precaution, advice has been provided on simple steps to reduce the risk of transmission should the virus cause illness in Victorians. Most important is to regularly wash hands, and for health workers to wear a simple mask, gown and gloves when assessing people who might be at risk. What are the symptoms of 2019 NCOV? Information continues to come to light as more is learned about this new infection. The most common symptoms reported as of January 2020 include fever, breathing difficulties such as breathlessness, cough, sore throat, fatigue or tiredness. While there have been some deaths reported and some cases have been severe, the early indications are that the virus is not likely to cause illness of the severity that was seen in the severe acute respiratory syndrome SARS outbreak in 2003. How does 2019 NCOV spread? Health authorities around the world are working hard to figure out exactly how the 2019 NCOV virus spreads. At first, most people who caught the virus either worked or visited the Wuhan seafood market in central China. However, now not all cases are linked to that market. The World Health Organization (WHO) has assessed that the virus can spread between people. China's National Health Commission has now confirmed the virus has been passed from person to person and has infected some healthcare workers. When person-to-person spread has occurred with MERS and SARS, it is thought to have happened via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. What is the incubation period for 2019 NCOV? The incubation period is not yet known. However, based on the nature of previous coronavirus infections, it may be up to 14 days. What should I do if I think I might have 2019 NCOV infection? If you or a close contact have visited Hubei province in mainland China in the past 14 days, stay home until 14 days after leaving Hubei. If you are ill and have traveled to an area of the world where there is active transmission of novel coronavirus in the 14 days prior to the onset of your illness, you should call ahead to your general practitioner or emergency department before attending and inform them of your concern. When you arrive at a clinic or emergency department, you will be asked to put on a mask and will then be isolated in a room where available. Your doctor will ask you about your symptoms and where you have travelled. How is 2019 NCOV diagnosed? If you have a risk of having the infection, your doctor will take a sample from your nose and throat and will organise for that sample to be tested at a laboratory to determine if you have 2019 NCOV. You will be asked to remain isolated from other people while this testing takes place. How is the 2019 NCOV infection treated? There is no specific treatment for disease caused by 2019 NCOV. However, many of the symptoms can be treated and therefore treatment will be based on the patient's clinical condition. How do I protect myself and my family? There are some common sense precautions that you can take to protect yourself and your family. These apply to many infectious diseases. These include: encourage people around you to cover their nose and mouth with a tissue when coughing or sneezing, or cough or sneeze into the crook of your elbow. Dispose of the tissue into a bin and then wash your hands afterwards. Wash your hands regularly with soap and water, particularly after going to the toilet and before eating food. If soap and water aren't available, use an alcohol-based hand rub. Avoid touching your eyes, nose and mouth with unclean hands. Here's what else is being done. The Victorian Department of Health and Human Services is working with health authorities across Australia and the world to monitor and track the situation. The department is also working closely with health services and health professionals in Victoria to provide clear advice on assessing patients, testing people who may have the infection, and on how healthcare workers can protect themselves. Just like other states and territories, Victoria has well-established procedures to ensure people arriving at ports of entry like Melbourne Airport are assessed for illness. Airlines are already required to report passengers who show signs of an infectious disease on a flight, including fever, sweats or chills, so sick travellers can be met by biosecurity officers when they arrive in Australia and be assessed. Do I need to wear a face mask? Face masks are not recommended for use by members of the public in Victoria for the prevention of infections like 2019 NCOV. Should any healthcare professional be required to treat a suspected or confirmed case, they will be supported by following standard infection control guidelines. Advice to travellers in areas reporting 2019 NCOV cases. For travel information regarding 2019 NCOV, visit the Smart Traveller website. Where can I find out more information? For updates from the Victorian Government on the current incident, go to dhhs.vic, Novel Coronavirus section. For national updates, visit health.gov.au, News. For international updates, visit who.int, Novel Coronavirus 2019 NCOV. For more information on WHO resources, visit WHO Resources Coronavirus.
And there you have it, guys. Stay safe during this outbreak period, and I'll see you guys soon. Bye.